love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Robena Wilkinson, health educator at the Health Promotion Unit. As we should all know, dental hygiene is very important. To explain how important dental hygiene is, I have with me dental nurse Robena Wilkinson to give us some insights.
Good evening, viewers. Thank you, Robena, for having me once again. Our topic for this evening is entitled The Effects of Dental Caries on Our Children. Now we know school has recently been reopened and the children have vendors selling stuff, or even us as parents. So we love our children and so we pack them up with lots of snacks. But the question is, are those snacks nutritious? Let's find out the impact of having a nutritious snack. Talk about dental caries. Now, can you tell me, what is dental caries?
I think dental caries probably rotten teeth in children or badly cared for teeth. So it's visible that something is wrong with the teeth.
Correct. Simply put, dental caries is just about rotten teeth. Now, dental caries has lots of names, which means the same thing. Dental caries is known as tooth decay, cavities, or caries, and even rotten teeth. It is the breakdown of the teeth over a period of time between the acid-producing bacteria and fermentable carbohydrate and the teeth. What this is saying is that when we eat our food, we do not brush our teeth, and it stays in there for about 20 to 30 minutes, acid-producing bacteria. Acid production begins to form. And once that is there, it attacks the tooth. And so we have a little demonstration. We give our kids, remember before I asked, what kind of snacks do we give our children? So here we have this parent A, who has sugar. They give them soda, lollipop, chewing gum, and this is not the sugarless chewing gum, biscuit, chocolate, and you give them all these snacks and cheetahs, and we say, yes, we love them, and you pack them up with these things. But what happens when the child eats those snacks? Now, we all have bacteria in our mouth. We were born with bacteria in our mouth. And so when the child eats those snacks and bacteria start acting after 20 to 30 minutes, it forms an acid. Now what will the acid do? The acid will attack our healthy teeth. And by attacking it, it begins to break down our teeth and forms tooth decay. And you see the tooth looks sad? Yeah, that is how we actually are when we get toothache. Very sad and crying in pain. Now, one might wonder, what are some of the symptoms of dental caries? Toothache. You have patients with pain. Ouch. They also have difficulty in eating the foods, chewing the foods. And sometimes they also have abscess or infection. And those two big yellow bumps, there is just actually the infection that the patient going through. Now that is very, very painful. Other impacts is loss of body weight. You wonder why loss of body weight. If the child cannot participate in having a healthy meal because of toothache and not eating, then the child will become malnutrition in some cases, worst scenario, or the child may even have loss of body weight. And yes, we have seen children who are malnutrition who come at our dental units just because of cavities in the mouth. They have so many cavities in there, cannot eat the healthy nutritious food, and so become malnutrition. Another impact of it is loss of education. Reason why I say loss of education is that when you have to take the child out of school to take the child to the dentist, when I say out of school, I'm not talking about the school program, because we at the dental unit do have a dental school program where we bring the children. I'm talking about outside of that school program, when the child has a toothache and you have to take the child away from school to bring the child to the dentist. Teacher at school is continuing the educational sessions. They're not going to wait and say, oh, Johnny has left to go to a dental appointment. Let us wait until he comes back. They're going to continue. Now, when Johnny returns, if Johnny is not responsible enough in terms of saying, I'm going to ask one of my friends to discuss what we have done in school, or I'm going to ask teacher to explain to me what was done, that session would have been missed. And normally when the children return, they will always like to run, go and play. So we're saying that to avoid loss of education in terms of taking them away from school, missing their sessions, try and bring them to the dentist, okay? And to have regular checkups. Then another impact would be tooth loss. And here we have our friend with the tooth front tooth. Now you realize that the tooth front tooth have been fractured. So it's just pieces of the front tooth that remained right there. This is because the child had cavity in front of the teeth, and then the teeth eventually chipped and break off. And when that happens, we have low self-esteem. And there we have some children laughing after my poor little boy. Yes, it's not a good experience. So our front teeth are important because they help us to pronounce words properly. When we pronounce words beginning with TH, this, the, these, words beginning with Z, zebra. Now, our teeth help us to pronounce words properly and to speak and pronounce those words properly. Without those teeth, we cannot speak properly. And so children will laugh after other children. When they say, oh, man, you can't talk, hush your mouth, you say you can't talk. And so the children will eventually feel bad. And then the self-esteem, children are not attached to others because children make fun of them, and so they go away in their own little corner feeling very sad. However, though, there are treatment for our dental cavities, and we recommend you do fillings or even possible extractions. Now, our dental cavities can be prevented. And how do we prevent it? By encouraging our children to eat a diet low in sugar, which means eating more fruits and vegetables. And I may add in here, drink lots of water. Encourage them, as we say, brush your teeth after meals. Okay? We have started this program in preschools where we are encouraging parents and the teachers to write down the name of each child onto the toothbrush. So I know for sure it's been done in some of the preschools. Now you can also feel free to continue it in the primary or secondary schools. Okay? And encourage them to brush after meals. So after eating their lunch, go to the bathroom, have the toothbrush and toothpaste, and brush your teeth. If the parent is not in a position of giving the child a toothbrush and toothpaste, then we ask them to wash their hands thoroughly with soap and water, and then to use water. Water is readily available at the school. We have the tap water. Get some water, put it in your mouth, rinse out your mouth after meals. At home, we recommend that you do flossing. Encourage the children to floss. So parents encourage our children to floss. If they are not able to do it, then feel free to go about flossing for them. We recommend you do that daily, once daily. Also recommend you have regular dental visits, and that is done every 6 months. And I am going to demonstrate to you the proper brushing techniques. First, we need a soft or medium toothbrush. Reason being that the bristles are flexible, they can bend. And so we need them to bend and curve to take away, remove the food debris from our teeth. To reach to the last tooth at the back, you open the mouth, place it in, and then you close down to accommodate the last tooth to the back. If you open too wide, the brush would not reach way to the back. So remember, you open, close down, so the brush go way to the back, and then you go, the bristles are placed along the tooth and the gum line, and then you go around and down, around and down. Going around is to remove any food particles on the surface of the teeth. When you're coming down, any food particles that's trapped in between the teeth, it takes it away. When we finish brush the outside, we brush the inner surface of the teeth, around and down. When we reach in front, we hold the toothbrush vertically, straight out, to remove food debris. If you hold it horizontally, chances are you're going to miss some of the tooth surface to the underneath. So hold it vertically straight out and bring it out. The bottom, we're going to do the opposite, around and up. Same thing, around, remove the food particles, and up to remove any food particles in between the teeth. Then you brush the inner surface. Remember, you reach in front, hold it vertically again. And then the chewing surfaces. These are the ones to the back where the grooves are. If you take your tongue and you put it there, you'll be able to feel it. So when we chew our nuts and food, the molars, we brush them. Now, when you have finished, we recommend that you brush your tongue. You would have realized I did not brush the front of the tooth cross like this. And there's no reason to do that. Once you would have brushed the outer surface coming down and the inner surface, all of the structure for the front teeth would have been brushed. We only brush the back ones on top because the food particles will be able to trap inside there. Okay? So remember to use a soft or medium toothbrush. And in conclusion, we recommend, remember to say, give our children more fruits and vegetables. Apples, bananas, mangoes. I know Chevron and Nisbet is very good at telling us what food to eat for the week. So let us take good opportunity and use those fruits. So have them to have more fruits. Give them lots of water. Water is good. You do not have to give them juice every day or juice with meals. Give them water. Okay, lots of water. And remember, as I said before in another presentation, if you're going to give them gum, ensure that they use sugarless gum. Okay, make sure you have the ingredient xylitol. And I repeat, it's Xylitol, xylitol. Okay, with that, it produces saliva and it also takes away food debris from our mouth. And let us remember, parents, the children are a gift from God. And He entrusts us to take care, very good care of them. So if we love our children, let us take good care of them to the best of our abilities. Not just by giving them physical stuff, dress codes and lots of sugary stuff because we love them. But let us take good care of them by taking good care of their health. And this also includes their oral health. Thank you very much for watching and do have a pleasant evening.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.